Nursing interview questions. What are the different types of insulin? There are 6 types of insulin. Rapid acting insulin, short acting insulin, intermediate acting insulin, long acting insulin, ultra long acting insulin, pre-mixed insulin. What is hypoglycemia and how do you manage it? Hypoglycemia means low blood sugar, usually less than 70 mg per dl. It is managed by giving oral glucose, like sugar water or juice. In extreme cases, IV 25% dextrose is administered. What is anaphylaxis and how do you manage it? Anaphylaxis is a life-threatening allergic reaction. Management includes intramuscular adrenaline, oxygen, fluids, and antihistamines. What is the full form of CLABSI? Central line associated bloodstream infection. Give an example of isotonic, hypotonic, and hypertonic solution. Isotonic solution, normal saline. Hypotonic solution, 0.45% saline. Hypertonic solution, 3% saline. What is the dose of adrenaline during CPR? 1 mg IV every 3 to 5 minutes. How do you prevent CAUTI? Catheter associated urinary tract infection. Maintain sterile technique during insertion, hand hygiene, daily catheter care, and remove the catheter as early as possible. What precautions should be taken while giving IV potassium? Never give IV push. Always dilute and infuse slowly. Monitor cardiac rhythm and other vital signs. What is Glasgow Coma Scale? GCS. GCS is used to assess the consciousness level of a patient. Score ranges from 3 deep coma to 15 fully awake. What will be the Glasgow Coma Scale score of a dead person? The Glasgow Coma Scale score of a dead person is 3, which is the lowest possible score. For a dead person, score for eye opening is 1, no eye opening. For verbal response, the score is again 1, no verbal response. For motor response, the score is again 1, no motor response. Total 1 plus 1 plus 1, 3. GCS does not confirm death. It only assesses level of consciousness. A score of 3 indicates deep coma or brain death. But clinical confirmation of death requires additional assessments like absence of brainstem reflexes, ECG asystole, or apnea tests. So in conclusion, the GCS of a dead person is 3, the minimum score. ARDS, acute respiratory distress syndrome. DVT, deep vein thrombosis. PE, pulmonary embolism. MODS, multiple organ dysfunction syndrome. SIRS, SIRS, systemic inflammatory response syndrome. ABCDE patient assessment. A. Airway. B. Breathing. C. Circulation. D. Disability. E. Exposure. VAP bundle. VAP stands for Ventilator Associated Pneumonia. The key components of VAP bundle are elevate head of bed 30 to 45 degrees, daily sedation interruption and assessment for extubation readiness, peptic ulcer disease prophylaxis, deep vein thrombosis prophylaxis, DVT prophylaxis, daily oral care with chlorhexidine. WAP bundle is a set of evidence-based interventions applied together to prevent ventilator-associated pneumonia in mechanically ventilated patients. What are the main electrolytes in the human body? The main electrolytes in the human body are sodium, potassium, calcium, magnesium, chloride, bicarbonate, phosphate. What is the use of crash cart in ICU? Crash cart contains emergency medicines and equipment needed during cardiac arrest or emergencies. What is the normal range of serum potassium? 3.5 to 5.0 milliequivalents per liter. Management of supraventricular tachycardia, SVT. First, we have to make the initial assessment. Check ABC, airway, breathing, circulation. Monitor ECG, blood pressure, oxygen saturation. Then identify if patient is stable or unstable. If patient is unstable, immediately go for synchronized DC cardioversion. If the patient is stable, that is, if all the parameters are normal, go for vagal maneuvers, that is, for example, Valsalva, carotid sinus massage. These maneuvers should be done only if there are no contraindications. And if the patient is stable, IV adenosine IV bolus can also be given. First dose 6 mg rapid IV push, followed by saline flush. Second dose, if there is no response with the first dose, 12 mg should be given. The alternate medications which can be given if the patient is stable, if adenosine is contraindicated or ineffective, calcium channel blockers like verapamil, diltiazem, and beta blockers like metoprolol, esmolol can be given. Consider synchronized cardioversion if the condition of SVT persists or deteriorating. For long-term management and to prevent recurrence, electrophysiology study, radiofrequency catheter ablation, and maintenance drugs should be given if ablation is not possible.